Hi, my name is Dr. Breanna Jedrzejewski, and I'm here today to talk to you about breast augmentation. Um, During our initial consult, which will be either over the phone, through video, or in person, we'll talk about what to expect not only during the surgery, but leading up to the surgery and after the surgery in terms of recovery so that we can optimize your surgical results. The first thing that we'll want to do is review your medical history thoroughly. I encourage you to be as transparent as possible in terms of disclosing your medical and social history so that we can address your concerns that are specific to your situation and work with you to move forward with surgery in the safest way possible. My number one priority is to ensure candidacy for a safe surgery and to optimize your surgical outcome. In order to do that, we need to minimize the risks of surgery. And risks that we want to minimize include wound healing issues, bleeding, adverse reactions to anesthesia, and other complications. So let's start off with bleeding. We'll review your medications and make sure that you're not taking anything that would increase your risk of bleeding. Common medications that can do this are NSAIDs, also known as non-steroidal anti-inflammatory drugs, including aspirin, ibuprofen, and naproxen. If you're on these medications, we may ask you to stop about a week before surgery. If you're taking Tylenol on a daily basis, that is okay to continue. In terms of smoking or nicotine use, nicotine in any form, including vaping, it's important to avoid nicotine 6 weeks prior to surgery and 6 weeks following. This is because nicotine constricts tiny blood vessels that we rely on for healing after you make an incision and dissection in order to heal from surgery. In terms of weight, I do not have a BMI cutoff for breast augmentation, but it's important to know that the higher your BMI, the higher your chance of needing a revision after your initial surgery. There's also increased risk of having problems in anesthesia. And if you have any comorbidities like heart or lung problems, these will need to be resolved or optimized by your primary care provider prior to surgery. It's important to have a stable weight of at least 3 to 6 months prior to surgery because that will give you the best aesthetic outcome possible. If you have type 1 or type 2 diabetes, this can create problems that can lead to wound healing or infection if your blood sugar levels are too high. So we'll want to get a recent A1C blood draw to make sure that your sugars are in a range that are safe to proceed with surgery. In terms of autoimmune diseases, if you are on any medications like steroids, those can have problems with wound healing. And so we'd want to take a look at those and come up with a plan in order to stop those medications around the time of surgery. If you have HIV, we'll want to make sure that your viral load is low and that you're appropriately suppressed for the time of your surgery. If you have any personal or family history of blood clots or reactions to anesthesia, we'd want to know about that so that we can keep you as safe as possible during your surgery. If you have any personal or family history of breast cancer, we'd want to know about that. And if you fall within the range of current protocols, we'd like you to get a mammogram prior to your operation. I'd also want to know about any allergies you have to any drugs or foods or any other medications. And I'd want to know what kind of surgeries you've had in the past, just to make sure that your experience was within the realm of normal in terms of anesthesia and post-op recovery. So it's important to talk about social support. Surgery is a physiologic stress on both the body and the mind. It's not uncommon to have feelings of negativity, depression, or anxiety post-operatively. Studies have actually shown that the strength of one's social support network can significantly enhance recovery after surgery. Everyone's social support may look different. Family, friends, chosen family, mental health providers. It's important to have a plan in place for who is going to support you as you recover from surgery. Before moving on to the physical exam, I want to know what your goals are. In particular, for breast augmentation, it is helpful to know whether you would like an augmented chest that is proportional to your body or smaller or larger. If hormones are part of your gender expression, is best to wait about a year after initiating estrogen so that the majority of breast development has already occurred. This allows for optimization of your augmentation and reduces the unpredictable nature of breast development, which can happen later, which may cause some asymmetries. So in terms of implants, or breast augmentation in general, there are some important things that we need to talk about. One would be the type of implant. Two would be the incision that we use or the approach. And the third important thing would be the pocket location, or where we're going to put the implant. So I'll start by saying that 95% of women opt for silicone implants, smooth, round implants, which are soft and natural appearing. I only use smooth, round implants, either silicone or saline. I do not use textured or anatomic shaped implants due to their association with ALCL, which stands for anaplastic large cell lymphoma, which was reported in 1 in 3,000 to 1 in 30,000 women who received textured implants. So I just don't use those at all. We'll use either smooth round silicone or smooth round saline, which has a smooth silicone shell. In terms of size, the most important measurement that I will take is your breast width, or the kind of footprint of your breast. We don't want an implant that is too wide because it would extend past your chest wall and kind of get in the way of your arms as you're moving. It would look unnatural. We don't want a breast implant that is too narrow because that won't allow for cleavage, and it will look as though your breasts are very far apart on your chest, and like the base is too narrow. So we'll take the measurement of your breast width, and we will look at the volumes that exist in the range of those measurements, and we can talk about them, so that we can find the right implant for your body that will fit your goals. In terms of incision, there are a couple of ways to make an incision for a breast implant. Typically, I use an incision that sits just below the breast. It's called the IMF incision, which stands for inframammary fold. And in my hands, that is the most predictable approach to breast augmentation. There are other incision types, which include periareolar, where you incise usually the lower part of the nipple areolar complex and use that to enter the pocket and place the breast implant. And also, there is a possibility to put the implant in through an incision made in your axilla or under your arm. But these approaches have a higher risk of infection and implant malposition, so I don't typically use those incisions. The other thing that we need to talk about is where the implant is going to sit, or the implant pocket. So implants can be placed above or below the pectoralis muscle, and there are pros and cons to each approach. So before I continue, let's just review. You have your skin, you have your subcutaneous fat, you have your breast tissue, your native breast tissue, and then you have the pectoralis muscle. So implants either sit above the pectoralis muscle, below your breast tissue, or they sit below the pectoralis major muscle and on top of your ribs, and pec minor as well to the side. So first of all, not everyone is a candidate for subglandular, also known as prepectoral placement, because you need sufficient skin and soft tissue overlying the implant in order to have good coverage for that implant. The benefit, however, if you're a candidate for subglandular, is that you don't have to disrupt the pectoralis muscle, making it less painful immediately postoperatively. And also you eliminate the risk of animation deformity. So animation deformity is what happens when the implant is sitting underneath the pectoralis muscle. And when you activate the pec, the implant moves with muscle activation. It usually moves up and out toward the side. So this doesn't happen with everyone who gets an implant placed under the muscle, but it's a risk that you eliminate by having the implant placed on top of the muscle. A downside of having the implant placed on top of the muscle is that there's a slightly increased risk of capsular contracture compared to submuscular placement. So capsular contracture is when a scar, hard scar tissue around the implant can sometimes cause tightening of the implant pocket. And that can make the implant look weird, and it can also cause pain in some circumstances. So that's a risk with implants, no matter what pocket you choose, but the risk of capsular contracture is slightly less if the implant is under the muscle. So let's talk about the risks of breast augmentation surgery. The risks of surgery that are similar to other procedures include pain, infection, scar. In terms of scar, we know we're going to have a scar anytime we make an incision, but sometimes the way that people scar can be better or worse. That kind of just depends on how your body handles scar. Some people are more prone to developing a hypertrophic scar, which means the scar is more raised, more noticeable, kind of thick and ropey. Some people are prone to keloid scarring, which can extend actually past the borders of the incision. And again, that kind of has to do more with your body's physiology. And if you have a history of those kinds of scarring, it'll be good for us to know so we can watch closely after surgery and address the problem as soon as we can. There's a risk of asymmetry with any operation. In this case, no one's breasts are completely alike, and that is because no one's chest wall is completely symmetric. And then the amount of tissue that we have overlying our chest wall is different from side to side. It's impossible to make breasts completely exactly the same. So our goal is to make them as similar as possible, with the understanding that breasts are sisters and not twins. So that'll be something important to keep in mind. If your nipple on one side is higher than the other, that will continue to be the case after you have implants put in. If you have one breast that is larger than the other one, chances are, if we use the same volume implant on both sides, that breast will continue to be larger. So that's something that we need to take a look at during the physical exam, make note of, and talk about if that's a concern for you. There are risks of hyper or hypopigmentation, which means discoloration of your incision. And that's why it's so important in the first year, especially after surgery, to wear sunscreen over your incisions anytime that they are exposed to the sun, or even better, cover those incisions with clothing, so you can reduce the risk of damage of the coloring of your incision by the sun. There's a risk of delayed wound healing, which is higher in people who have higher BMIs or who have higher blood sugar levels or autoimmune issues. In young, healthy people, usually they don't have delayed wound healing, but that can be, that's a risk of surgery that's important to know about. Numbness and hypersensitivity. So anytime we make a a space in the body and put an implant in, we're stretching the skin and soft tissues and the nerves that are overlying that implant. So it is possible to have numbness on your chest or your nipple where you didn't have it before, or hypersensitivity. And hopefully that will resolve itself within several months. But it's something that's important to know so that you're prepared in case that's your situation after surgery. So there's a risk of bleeding in surgery, obviously. And there's a 5% risk of that bleeding causing us to need to go back to the operating room for another procedure shortly after your first procedure. So you would know this because one side of your chest would suddenly get much larger than the other side of your chest. And that's why we have you stay in the Bay Area for up to a week after surgery, because the risk of bleeding that necessitates a return trip to the operating room is highest in the first 48 to 72 hours after surgery. So that will be something that we are watching for. But during surgery, we make sure that everything looks dry before we close the pocket. But of course, 5% of the time, it's difficult to predict. This happens to 5% of patients. And so hopefully you're not in that 5%, but if you are, don't worry, we will take care of you and we will address the problem, and patients do just fine, even if they need a second procedure. So you can have a collection of blood that doesn't necessitate a trip to the operating room. We just call that a hematoma. And that will usually just go away on its own. A seroma, which is a collection of fluid that is protein rich, kind of clear, straw colored, and your body makes that fluid anytime you make a space that wasn't there. So in this case, we create a pocket for the implant. Even though the implant's sitting there, you can still get collection of fluid. Usually it goes away on its own and it's not a problem. Anytime you're operating in the body, there's a risk that you'll do damage to surrounding structures. If there's anything that we damage during the operation, we'll let you know and we'll address it at the time. But that's just the nature of surgery. There's also a risk that you might need other procedures, like we talked about, over the risk of needing to go back to wash out bleeding, stop bleeding. There's also risks of needing revisions after surgery. And we'll talk a little bit more about those, but there's a risk of anesthesia, which includes blood clots to the legs and lungs, and even death. But yeah, in young, healthy people, this risk is extremely low. And you can talk more about it with the anesthesia provider on the day of surgery. But that's a risk of general anesthesia that everyone needs to know about. There's also a risk of regret of having surgery for various reasons. We can talk more about this in person if you have more questions, but it's important to know that at least in the current literature, the risk of regret for gender-affirming surgery is very low. It's less than 1%. And to put that into perspective, the risk of regret for knee surgery is about 10%. So again, very low risk of regret, but it's not a non-zero risk of regret. Specific to the use of implants, an implant is a man-made device, and so there's always the risk of implant failure. Implants can fail in a couple of ways. One could be it could rupture. That happens 1% of the time, and you wouldn't necessarily know that an implant's ruptured if it's a silicone implant, because they're highly cohesive. They've also been called gummy bear implants. Basically, if you made a cut in it, the material wouldn't go anywhere and you would maintain the shape of your breast. So you would pick up an implant rupture on imaging. Let's say that you had imaging for some reason, and you were concerned about your implants, or you had a car accident, and if it picked up that your implant was ruptured, then we would want to replace that and just put a fresh new implant in. Capsular contracture, which we talked about, could be another reason to revise either the implant pocket or change the implant out for a new implant. Animation deformity, which we talked about, if the implant is under the muscle, it might be a reason to move the implant above the muscle. Implants can also have rippling or malposition. They can get in the wrong position, or they can extrude, which is the worst case scenario when the implant kind of comes into contact with the outside world and we need to take it out and make sure there's no infection. And then we can put a new one in after. There's also the desire for having larger implants than what we've put in, or smaller implants than what we've put in. And that's also a risk of surgery, that you will need more surgery. So in terms of leading up to surgery, 1 to 2 weeks prior to surgery, we'll have our preoperative visit, either over the phone, if you're not in the area, or in person, preferably in person if you're able to come to our office. So we'll review the surgical plan and you'll receive your prescriptions for before and after surgery, including medications for pain and nausea. So on the day of surgery, you and I will meet. You'll come to the surgery center or the hospital, depending on where your operation is, 2 hours prior to surgery. We will get your consent to proceed with the operation that we've agreed on. And I will probably do some markings to note anatomic landmarks on your chest. Surgery lasts about 2 hours, and you'll wake up with a surgical bra, which will help your implants to scar into the right position in the coming weeks. We will have injected long-lasting numbing medication during the surgery, and that lasts about 12 hours. We will give you a small narcotic prescription in addition to scheduled Tylenol and ibuprofen at the max doses. And as long as you don't have any contraindications to these medications, our patients usually do quite well in terms of pain after surgery, and don't need very many of the narcotic pills in general. So you'll spend 1 to 2 hours in the recovery area to make sure that you've cleared all the anesthesia and that your pain is under control. If you do not live locally, we do ask that you stay in the Bay Area for at least a week following surgery, and so you'll discharge to wherever you're staying locally. Immediately post-op, it's important to know that your breasts will look very large and swollen and high up on your chest. They might also look boxy, and that's totally normal as it takes the implants some time to settle. So they will start to look better by 3 months. They'll look good at 6 months, and they will look fantastic at 12 months. That will be your final result. Bruising is normal right after surgery, and we'll have you take arnica if you're interested in minimizing bleeding prior to surgery. We'll have you take it post-operatively. And you might have some small audible fluid collections like we talked about, either seroma or hematoma, but as long as these are not rapidly growing, it's okay to let them resolve on their own. Your implants may look more lateral compared to cis female chest, and this is because your nipples will be in more lateral position on your chest, but this is normal. And in time, areolas generally stretch out, but if they don't and you desire larger areolas in the future, you can always use tattoo to achieve that if you're interested. It's important that you maintain your nutrition and exercise before surgery, but also during recovery in terms of nutrition, in order to optimize your healing. And also to minimize constipation, we'd like you to take stool softeners while you are on narcotic pain medication. You may start silicone scar treatment once your incisions are fully healed, or as soon as 3 weeks post-op, and you can buy these online. Keep in mind that the scars will look red and raised for at least 3 months and then begin to soften, flatten, and lighten over the course of the year. If you begin to develop thick, ropey scars, we can intervene early with steroid injection to help mitigate this. So activity restrictions following a breast augmentation include maintaining your surgical bra for at least a month after surgery. It's okay to take it off to wash it, and it's also okay to buy soft sports bras without an underwire, preferably that open and close in the front. If you would prefer to wear that instead of the bra we give you, that's totally fine. So you can sleep on your back if you can for the first month after surgery. That would really help. And after 2 weeks, you can return to a desk type job. If you have a more physical job, we'd ask that you wait 6 weeks until returning to full duty. But you can return earlier if you're allowed to do light duty, and our office can provide you with a letter for your job. So it's important to avoid lifting your shoulders more than 90 degrees for at least the first month after surgery. No heavy lifting more than 10 pounds or walking large animals on a leash for at least 6 weeks after surgery. No submerging your incisions into water like a bathtub or jacuzzi until 6 weeks after surgery. And if you use nicotine prior to 6 weeks before surgery, you may not resume until 6 weeks after surgery. But my hope is that you can use this opportunity, having quit, to avoid restarting and improve your overall health. Your scars will take 12 months to fully mature, and it's important to use sunscreen on them anytime they're exposed to sunlight. It's important to note that you should continue to adhere to routine breast cancer surveillance per current recommendations for the rest of your life. In terms of follow-up, after the initial post-operative appointment, which is about a week after surgery, I will see you 6 to 8 weeks post-op and then at 3 months post-op to make sure that your healing is on the right trajectory. We would love to see you again at the 1 year post-op mark, either in person or virtually, to assess your final result. At the time of our consult, I will answer any questions you might have that haven't been addressed here, or even if they have been addressed here and you want to talk more about anything I've mentioned, that's okay too. If you have questions that arise after the consult, you can always contact our office and we'll be happy to provide you with more information. We also encourage you to submit ideal photographs of what you envision your result to be so that we can make sure that we are on the